to make this opportunity to us participate in this global program and very interesting program in the field of dentistry. Thank you so much for all of the Magnus team. I want to discuss today about my research about the people knowledge and opinion about getting dental implants against other conventional modalities in Herat city habitants in urban area in Afghanistan. This is one of my building in a very beautiful Herat University among 20 buildings in this nice university. The contents of this presentation include introduction, method and materials, result and discussion, conclusion, recommendation, and also the references. About the history of dental implant, all of you know better than me, the ancient Egyptian and Central American civilization started replacing the teeth with implant. First recorded case of replacement was an Egyptian kings, only approximately 1000 BC. And the replacement of tooth roots was performed in Europe about in 17th century by using a variety of material, for example, the elephant, tusk, and etc. Now there are approximately 15 million implants are estimated worldwide every year, and the highest market sharing in 2016 was the European countries, followed by North America and the Asia Pacific. About the history of dental implant in Afghanistan, it's back to 2004 with the professor was from Pakistan, Professor Chaktai, Rashid Chaktai, was the first evidence of dental implant in Afghanistan in an academic way that get many implants in special hospital, stomatology hospital in Kabul, capital city of Afghanistan. The purpose and aims of this study were to understand the opinion and knowledge of people against dental implants, and also lack of study in Afghanistan about knowledge, opinion, and thinking about dental implants. And also we hypothesized that the knowledge and awareness of Herat habitants according dental implant is not suitable and not satisfactory. It's the Buddha's sculpture, one of the oldest Buddhist sculpture in the world, that back to 578. The how, method and materials. Study design was cross-sectional and the duration of the 1 month. And after that, I did a literature search. I found a lot of literature in all over the world according to these questions. But unfortunately, in Afghanistan, when I did literature review, I didn't find any literature about this topic in Afghanistan. Unfortunately, it's the first research according to this question in Afghanistan that I did. And also I did some information about the history of dental implant, and I found the first one that did implant in Afghanistan was Professor Chaktai from Pakistan. They did many implants in stomatology hospital in Kabul, Afghanistan. And I selected population among the whole population of the Afghanistan, and also the Herat city habitants, more than 600,000 people. And according to Ralsop, I selected population, and among the all 15 districts of Herat city, and each district population, and also the ethical committee approval with a questionnaire-based study with a direct interview. The questionnaire included patient consent form, short implant introduction in the questionnaire, and also demographic part, and 16 open questions about to evaluate the knowledge of people among dental according to dental implants. And we did a short animation for each participant and direct interview. We collected data, analyzed the data in IBS SPSS program version 25. One of the other famous place in Herat city, the Herat Citadel, back to 330 BC. The results and discussion. According to gender, most of our participants were male by 60%. According to gender and treatment preference, the cross tabulation was significant because most of female refusing any removable dentures or removable prostheses. They agree with fixed and also implant prostheses. According to age, most of our population were under the 40 years, and the occupation, as you see in the screen, a student, self-employed, self-employed, and housewife. Most of our population were students. According to educational level, that this study launched in Herat urban area, not in rural area. Most of people were in university and high school, and less was in primary and secondary school. According to education, information about dental implant with the question, do you have any information about surgical procedure for placement of dental implant? With education, we found significant founding the university and the highly educated people had some information about the surgical procedure of dental implant, and also the knowledge of dental implant and education were significant relation. The educated people had a very good information about the dental implant and knowledge about dental implants. The question about the education and treatment preference, which kind of treatment do you prefer to your missing teeth? The cross tabulation showed us the most educated people prefer dental implant against the other ones. There is no any different or significant bonding between the occupation and treatment preference. The marital status was approximately 50-50, single and married. About the question, which kind of treatment do you prefer to your missing teeth? Most of our population agreed with dental implant by near to 60%, and very less percent, and approximately 10% agreed with removal partial denture. Most of people agreed with fixed prostheses and especially dental implants. The question about the evaluation of the knowledge of people about dental implants. Question was, have you heard about dental implant? Near to 67% heard about dental implants. The source of information, the most of source of information was medical staff and family and friends respectively, and also the TV, cyberspace, and the advertisement are the others. About the question, have you received a dental implant treatment before? 96% of our population answered no. About the question, do you have any information about surgical procedure for placement of dental implant? Near to 63% answered also no, and just 28% answered yes. Level of preference of dental implants as a treatment modalities. The patient answer us agreed by 80% with putting dental implants. Why the people use dental implants? They answer us, and they thought the implants was so stable and convertible, and also safe, other teeth, and aesthetic, prosthetic reasons they choose dental implant. Another one that rejecting and refusing dental implant, the most cause of refusing dental implant was economical issue, and also the other one was afraid of surgical procedure and pain. According to the question, how many years do you think an implant can survive in the mouth? Most of people, near to 42%, has answered the question more than 10 years or for long life. The question, what do you know about the oral hygiene care for dental implants? The people answer us by 96% well informed. Cleaning similarity with natural teeth, the answer was with more than 70% yes. It's similar with teeth. And also we add some question about trust in a treatment in Afghanistan. The question: Do you have trust in dental implant treatment in Afghanistan? Near to 60% answered yes. And the reason the doctors or practitioners are well experienced and there is a well equipment in Afghanistan. And also the people refusing treatment in Afghanistan answered by 67%. The doctors and practitioners are not experienced, and the treatment plans and also instruments are not standard in Afghanistan. According to question, the role of religious restriction against dental implants, we asked our participants, is there any religious barrier or restriction to getting a dental implant? Most of people answered no, but the rest, near to 6% answered yes, and 15% answered I don't know. Is there any religious restriction against dental implant? According to a health issue with dental implants, the participant answered us no by near to 50%. No any health issue with dental implant, but others, for example, near to 12% answered yes, there is any healthy issue, maybe the implant causes, or the 25% answered maybe the implant causes a health issue in our body. Based on knowledge and implant survival rate, we found significant that the two cross-relation of these two questions. Have you heard about dental implant, and how many years do you think an implant can survive in the mouth? There's a significant value that the people that heard about dental implant had a good knowledge about the survival rate of dental implants. According to heard about dental implant and surgical procedure of dental implant, the people heard about dental implant had a good knowledge about the surgical procedure of dental implant with significant value. The people that received dental implant had a good information about the surgical procedure exactly in dental implant put. And the age and religious restriction or barrier among again dental implant was significantly with increasing the age. The thought and thinking about dental implant was against dental implant. And also the cross-relation with the categorized age and which kind of treatment you prefer or preference of treatment. By increasing the age, the people agree with the removable partial denture and refusing the implant treatment and other fixed prostheses. Age and implant and health issue, categorized age with and implant health issue is not significant. The Nuristan province, a very beautiful province in the northwest of the Afghanistan with very good valleys and mountains. The discussion part about the knowledge about dental implants. We did a lot of study, for example, in Saudi Arabia, in India, in Syria, US, in Turkey. They found similar, our investigation was similar with the pulmonary study and so and DPNL et al. Found the similar results. According to source of information, medical staff was the first, and the family and friend was the second source of information among all these studies. For example, in Saudi Arabia, India, and Syria, and in US, Turkey, and Italy. According to implant survival rate, discussion shows also. This study also agreed with our funding, and also the most cost of rejection and refusing, also all the economical situation that's related to the other study, for example, supercussion in India, former Syria, and deep in US. Oral hygiene of dental implant versus natural teeth. The finding was similar with Al-Ajlan in Saudi Arabia and deep in US. And also gender and knowledge. The finding was similar with our study. The female had a lower mean score than the male, similar and related with the other studies, for example, supercussion in India. And patient knowledge increased with education and decreased with age. It's accepted by other studies, for example, Eleni in Croatia and India and US. Effect of dental implant on systemic health. Similar studies also accepted our finding. The treatment preference, dental implant was the first. As you see, the other study accepted that. At the conclusion, I have to say that gradually habitants' knowledge about dental implant was inappropriate. Preference of dental implants was the first step of treatment. The cost, afraid of surgery, and the pain were the most cause of prohibition and refusal of dental implants. Stability and comfortability, the most cause of acceptance of dental implants. They thought implants survive more than 10 years or for long life. Implant with clean, like natural teeth. More than half of our participants trust in dental implants treatment in Afghanistan. No religious restriction against dental implants and no health issues. The education, the gender, and the age play a significant role against dental implant knowledge and opinion. Thank you so much for my filter and my partners, for example, Dr. Emir Bejic, Dr. Nariman Koroko from Goethe University of in Frankfurt, and the Herat City Leadership, Faculty of Medicine and Ethical Committee, and Herat Stomatology Faculty, and 7th semester students. And also we have some recommendation increasing community educational level, introducing dental implants with trained staff, prohibition of untrained staff in the field of implant dentistry, helping the media and more research. And these are the references. Thank you so much for your attention. If you have any question, I'm in front of you. Thank you so much.